Ozempic face. It's a term you're going to hear more frequently because we have 20 million prescriptions written annually for these GLP-1 agonists, Ozempic and MOUNJARO being the two most popular ones. But what is the Ozempic face? And does it truly exist at all? Well, people who had taken Ozempic and lost a significant amount of weight, greater than 40 pounds, in a relatively short period of time, developed a constellation of facial features known as the Ozempic face. It includes fine lines and wrinkles developing in the forehead, sunken in eyes, a sallowness and hollowness to the cheek due to a loss of buccal fat. That leads to skin sag, most notably at the jowl area, and some people even develop a fold from the chin to the corner of the mouth. And all of these facial changes give you an aged appearance. But is it really Ozempic face? Unfortunately, no. The Ozempic face is basically a coined term for a very popular medication. And if you had any type of severe caloric restriction and lost a significant amount of weight in a short period of time, you too will develop very similar facial features. So what can we do about it? How can we avoid the Ozempic face? Well, there's a few things in the works. Possibly changing the program. In other words, instead of taking 0.25 milligrams for just 4 weeks of Ozempic, extend that to 6 weeks or 8 weeks before going up to the higher dose. Studies that might be showing that using lower doses could be almost equally as effective. So maybe not going to the full 2 milligrams per week for Ozempic and 2.4 milligrams per week for MOUNJARO might help. Sure, it's going to slow the rate of weight loss and probably the overall weight loss, but it might avoid losing these facial features. The other thing would be trying to maintain adequate protein intake, even though you don't have a good appetite, because the muscle wasting is going to be related to the amount of protein you take in. Maintaining adequate hydration could help, avoiding sun exposure just to avoid superficial skin damage, and also maybe collagen stimulation. All of these things might help avoiding the Ozempic face, or at least reducing it. I hope you enjoyed this video, and if you did learn something, I wouldn't mind if you give me a thumbs up, hit the bell, and click subscribe. And I'll see you at the future videos. Oh, and by the way, you don't have to write in the comments, I know I don't have Ozempic face.